Great. So thank you, Nan. We're being recorded. What we do, I'm going to start again. Welcome everyone to the, I think it's the 4th maybe virtual summit panel that the Colorado Mountain Housing Coalition has put together over the summer. We've had a variety of topics from state programs, construction costs. I think we had one on linkage, or trying to create things that in the local zoning that allow for more housing. This particular session, and I'm the vice chair for programs for programming at the Colorado Mountain Housing Coalition. My colleague Becky Gray is the president or president, I guess, and she wasn't able to make it. So I'm gonna hopefully do her proud and be the moderator of this panel and also one of the participants. But I'm really happy to be able to present this workshop on building a homeless response system of care, and particularly how do we do this in our mountain towns? How do we do more than just shelter and people who are homeless, but think about an entire system of care for people who have experienced homelessness, chronic homelessness in particular, but also the whole range of folks who may find themselves homeless in our mountain towns at any given time. I'm also very happy to introduce my colleagues who will be doing most of the presenting. I have Nan Sundeen. She's the head of human services for Pitkin County, and Lindsay Maisch, who is the deputy head, deputy director for human services, and then Cristina Gair, who is the executive director, is that your title, Cristina, for Mountain Family Services? No, that's the name of your, I'm sorry.
It's West Mountain Regional Help Alliance. Thank you.
Not even close. West Mountain. I got the mountain part in there. I just work with Cristina. I just think she's awesome. So I just by way of background, I've been in this position. I'm the housing director for the Town of Snowmass Village, which is in Pitkin County. West Mountain is a little down valley. We kind of work as a region often to try to address problems that are more than just one town. Christina's in the Roaring Fork Valley, but serves up and down the region. And we came together, and I'll let Nan tell you more about it, but I came to Snowmass Village from Connecticut, where I'd done about 15 years of work on the homeless response system. Most particularly in my case was housing, because I do believe housing is the answer in many ways to homelessness. But I was excited to see when I got here, not knowing a soul really, that there was a group that was starting to work on this issue. And these have become some of my favorite people that I've met. And I guarantee to those of you who are housing folks in the audience that you will find your people if you find the folks working on homelessness. And so I think what I will do at this point is we'll start our slides, and different ones of us are taking different pieces of this, but Nan's going to start out by, I think, setting the framework and talking about how we got started and where we've come.
Great, thanks, Betsy.
Sure.
Happy to. Hello, mountain housing people. How fun to present to you. We're gonna present to you a framework that's worked in our community for trying to build a homeless response system. I just want to encourage people, the webinar platform is not my favorite, but if you have questions, throw them in the chat. There are 4 of us, so we'll look for questions. We'll try to, as much as possible, have this, some of it be a two-way conversation, because I'm sure you'll have questions. And if we speak too fast, if we use acronyms, if we take too many shortcuts, let us know, because we've been deep in it for now 3-4 years, and sometimes we don't even know that we're not making sense to regular people. So I'm going to start by letting you know that we had a homeless coalition between 2002 and 2006. We had no services here, and as a human services director, I was afforded the opportunity to facilitate a broad-based coalition that resulted in basically establishing one nonprofit, the Aspen Homeless Shelter, and they started winter night shelters, and they have done it, I think, for 15 years. They also have a day center site here at the Health and Human Services building, which in Pitkin is a mixed use building. We share it with nonprofits. We stopped facilitating that group around 2006 because of the development of this one provider. But what we found over the years was that they were really not skilled in strategic planning or coalition building. And the population was growing and there were more needs. And so in 2018, we offered to step in again as facilitators to convene a group of stakeholders to see if we could develop a strategic plan to end homelessness. So because I work for the county and I've been in my job for a long time, we had a lot of contacts. We knew people who were interested. We had stakeholders from housing authorities, businesses, the private sector, the faith community, nonprofit community, and we were really adamant about including people with lived experience. And we started convening people in the fall of 2018. And we did, really a basic strategic plan. We started with definitions, which was really helpful because our group could fight about any word we chose to use around homelessness. We did an environmental scan to outline the continuum of homeless services and housing services, really from in our region, which is from Aspen to Glenwood Springs. And we established an organizational structure, which we'll get into a little bit later. In 2019, we were meeting with the coalition now only 4 times a year. We had a we had a steering committee that met more often and was guiding the work and helping with the agenda development. We did a gap and asset analysis. We established goals and objectives and outcomes. You can see there's a nice picture of us working here in the Human Services building. That's one of our working meetings where we're all trying to come together with common work. Because we were at this point working in committees, we had committees really take the objectives and the outcomes, and then we would come to the big group and vet them. We prioritize short and long-term goals. And also in 2019, we opted to join into a Build for Zero program with the region. And that is, I'll let Cristina talk a little bit more about Build for Zero because she manages it. But it was really our attempt to join regionally to try to end homelessness together because we're small rural areas. And we thought there might be more collective impact. We got to January of 2020, and in the January meeting, we had the strategic plan vetted by the stakeholders. And it was just fortuitous that it was January because we immediately moved into our committees. We had a committee for emergency shelter, supportive housing, We had a data committee and a communications committee. So remember, we were really focused on building a system of care, not just one solution to end homelessness. By March, COVID hit us. Our winter shelter closed at the church. So Human Services opened the winter shelter in our building, in our conference rooms from March until June 1st. And we used the vendor that was the provider for the shelter, and we just paid them to do the service here. Everyone amazingly stayed safe. Now, at the same time, we got FEMA non-congregate housing money. So we also had the ability to put anyone who was sick in non-congregate shelter in a hotel. We pretty immediately realized that not all of the people experiencing homelessness were welcomed at the emergency shelter, mostly because of behavior issues or past behavior issues. So we were getting reports that people were riding the bus and they had no place to go. All the buildings, as you will remember, were shut down. There was no place to shower, no place to do laundry, no place to have coffee. So because we had the strategic plan, we jumped into establishing a safe outdoor space. It is a complicated property. It's a CDOT property that's leased by the city of Aspen, and basically the county commandeered it during the pandemic emergency. We were able to get canvas tents. A lot of people live in their cars, and some had campers. And we set up a safe outdoor space for 26 people. We closed the emergency shelter June 1st. And at that point, then we really saw the safe outdoor space begin to fill. I can tell you more about that, but ultimately with the safe outdoor space, we brought in bathrooms, wash stations, disinfectant, tents, a big tent for cooking supplies, food supplies. And finally in November, when we realized COVID was not going to be over in the winter, we brought in electricity so that we had heat for people at the safe outdoor space. It's a pretty rugged place to live. But I think what I heard our housing search and placement say, we've placed almost half of the people who have been in the safe outdoor space in emergency shelter, rapid rehousing, or treatment. So it provided a tremendous amount of stability for people who were living in our, basically in our forest lands and on our open space. We also were successful applying for emergency solution grants through DOLA, and we've brought in currently over 850,000, and our vendor, who's going to be moving into taking over the services, brought in another 540,000 just in Pitkin. And this is all because we have a strategic plan. I really don't think we could have done any of this without a community-supported strategic plan. One of our big focuses was on case conferencing. I'll let Lindsay tell you more about that through our initiatives. But one of the gaps that we had was coordinating case management and helping people get from one place to the next. People tend to languish, and we did not have coordinated care. So we focused on that. And then finally, I think in 2021, this year, we, with our funding, we contracted with a nonprofit to administer the case management, the street outreach, and to be working with people towards a housing first model. We brought we have developed policies, we have procedures, and we brought in a consultant to train our community on what housing first means. We really had to get past a lot of punitive opinions about how to support the homeless, and to really move towards the principles of housing first, and knowing that when people have stability, there's more resources, there's more hope, really. They feel more hope, and there's more hope on the horizon. I think you can't see the last bullet, which says that this year we're working on transferring our knowledge and coaching a nonprofit to be able to pick up the system that we've built. And that's always our goal as a government, is really to start an initiative, but it's not our role to stay in as providers. So that's what we're working on now. Next slide. So through our plan, we created a vision to end veteran and chronic homelessness and to be on a path to end all homelessness. And it's pretty simple. It's not complicated. We never forget that that's our primary purpose. And it helps us really focus on who our clientele is and who it is not. We do have questions. Of course, everyone asks, if you build it, will they come? And the answer is no, they don't come in droves, but sometimes they do end up in our community, just like they end up in yours, through mobility and transportation and serendipity. But if people don't have ties to Pitkin, we are really using our case management to coach them elsewhere. Our focus in this is to really use our funds to serve veteran and chronic homelessness and families. We didn't anticipate that when we wrote this vision, but they are a priority population for us. And we try to serve the most vulnerable, which we use an assessment to determine their vulnerability. And so we're trying to get the resources to the people who need them at the right time. Next slide. Through the strategic plan that was approved in January of 2020, our goal was to expand case management and mental health access. Hold on a second, Greg, and then we'll take your thoughts. We want to focus on providing emergency shelter, and Lindsay can tell you about those initiatives, and then creating a rapid rehousing program. Those sort of in the short term between 20 and 21 is our goal. And by our longer term goal is we want to end veteran homelessness by 2022 and chronic homelessness by 2025. The interesting thing for us is now that we're counting and we have data, we only have 7 veterans in our caseload out of currently out of a caseload, out of a caseload of currently today, I think 60 something, we have 7 veterans. So it seems like it should be easy to house 7 veterans, but it's probably our hardest population. We have housing and we've had trouble getting them into it. So we're really using our motivational interviewing skills and other things. I do see that Greg is saying housing first is counterintuitive to many people. It does seem so, but what I think, since we've been doing it for a year, we actually have evidence that when people are stabilized in housing, they reach out for mental health support, they're reaching out for substance use support, they want to get jobs, and they're willing to sign leases. We did not have this muscle memory before we started. Like, housing first was a theory, but now that I've seen it, I feel, I think we all have demonstrated evidence that people, once they get stable in a shelter, in a stable shelter, they start to develop other goals for themselves.
Yeah, and it might be, this might be a moment to just define two terms I think that we've used that are key to what we've been working on. Housing first is one of them. And I think it's essentially, it means that there are not barriers to getting housing. Traditionally, in the homeless services world, people have gone into shelter and then they may go to transitional housing or sober housing in order to, if you will, kind of get the skills to be in housing. The Housing First turns that around and says, people need housing in order to be in a place in their lives where they can start to work on their other issues, so they get housing first, and then they start to work on their mental health or other sorts of health needs or their work needs and that sort of thing. It's very data proven that it actually, the efficacy and the recidivism is much lower with the Housing First model, because it's so much more wraps around the person and their needs, and doesn't make the basic need of having housing dependent on their behavior, their performance, if you will. To me, it's not really counterintuitive to me as a houser, because I think housing is kind of the hub around which lots of other things can happen, and it has proven that. Rapid rehousing, just for people who know that, it's sort of in a way related, which is that when people become homeless, we should try to get them back into housing as quickly as possible. That what happens in homelessness tends to perpetuate homelessness. So it's a variety, again, of wraparound kinds of services, often just financial services, financial assistance to get people from homelessness into housing in as short a period of time as possible. So I just wanted to define those two things for anyone.
Thanks, Betsy. I'm looking at Greg's thoughts, which we've heard here, right? And when I said we tended to be punitive before, I think that idea that housing is a reward is the principle that Housing First contradicts, right? Housing is a right, and then from there people get better. When we first started, the word on the street, the constant conversation from our stakeholders was people, they don't want to be housed. They're not going to want to be housed. Well, we have 20 people in rapid rehousing right now, 20, and that's just in a year. And that's in a place where there's no housing. So, what we've learned is the more stability we provide, the more people want to be in housing that they can afford, that's livable. So I think it's, just an extraordinary learning. And the way that we did it was, bringing in a subject matter expert for 6 webinars, talking about Housing First principles, case management, trauma-informed care, a whole bunch of things. And we all learned together, and we learned to challenge each other with these ideas that are pretty antiquated. So I will turn it over to Lindsay now.
Okay, thanks. I have one more thing to say about Housing First. So I think what helped me really kind of wrap my head around it, just to respond a little bit to Greg's comments, is someone explained it to me as like Maslow's hierarchy of needs, and like one of the main needs is, right, housing and food. And if we were using food as if we used food the same way that we're talking about housing, where it's like, oh, if you have good behavior, then you get a meal. That's not really, it's not really like that's a basic need that's needed. And we don't look at food that way. We have a lot of options and access to food in different ways, where we're not rewarding people. Well, I mean, we're not rewarding people with food necessarily. In the same kind of concept is for housing first, where shelter is one of those kind of basic human needs. So housing first is really focused around fulfilling basic human need, shelter being one of them. And once you stabilize that, it's like a person who can't eat is not going to have a ton of success with sleeping, with their mental health, with getting a job, with getting, you know, it's going to be very difficult. So it's the same concept with shelter or housing as well. That helped me. I don't know if that helps clarify for the group as well. So the coalition that Nan was talking about is we set up it's a sort of, I guess, governance or structure and have an org chart for the way that we are, for the way that we function, the coalition functions. So kind of in the middle of, and this has been organic and has continued to change over time as well. So in the middle of all of it is the steering committee, and the steering committee's role is really to have leadership and policy development in their purview. And this is really the people that make up the steering committee is a pretty diverse group. It's representatives from nonprofit, from health, housing, education, job training, food insecurity, really anyone who has some level of subject matter expertise that can help inform some of the decisions that are being made through this coalition. And then, so off from that, we have the planning committee. And the role of the planning committee is to really help support planning all of the agendas, building capacity for the coalition meetings, helping to manage kind of the lists of all the stakeholders, and working really closely on the planning committee has different committee work group leaders as well that help to inform any sort of agenda or next steps that the group might be considering. And then you'll see on this chart that there's the homeless response work group, the housing work group, and the data group work group, which those are the things that have kind of organically shaped and shifted as the priorities, as we, how do I say this, as we achieve some of the goals in our task forces, as we kind of get through some of that stuff, these work groups will shift or change. Like there will be new priorities that come up or new barriers so that the work groups are able to they're fluid. They're not married to being the homeless response work group or the data work group. I think now, I can't recall exactly what all the work groups are at this point, but they have shifted a little bit as well. But we have an emergency shelter group now, which is a little bit different. And communications is another one. So it's it keeps shifting and changing, but that's really good because it helps support what's happening in real time in the community right now. And then in the beginning of this, we did some focus groups where we brought together people with lived experience to help really inform the plan. So along the way, if we had developed new goals or new outcomes or when we had this strategic plan document, we would present that to people with lived experience, individuals with lived experience, and ask them like, are we on the right track or where are we going? Are we, or did we take a left somewhere and miss the whole concept? So they were really informative and helpful in addressing, some of the kind of larger coalition group decisions that were happening. Okay, so opportunities and initiatives. So let me talk through a few of these things. So in our community, what happened when COVID occurred in March a year ago, we were presented with opportunities because we were positioned with the strategic plan in place to be able to apply for some HUD, Department of Housing or DOLA funding to help support some of the strategic plan goals that we had, which happened to be really helpful in COVID because when we sheltered in place and individuals who are living in homelessness or unsheltered did not have a place to shelter in place safely, it really opened up the opportunity for us to look at how we were doing this as a community. So the first thing that happened, Nan touched on, which was the Health and Human Services building, when our winter shelter closed, did an emergency congregate shelter in-house in the Health and Human Services building. And that's because our winter shelter generally shuts down in March, and it's still very, very cold in March. And to Nan's point, when people were riding buses and kind of in places where that COVID exposure was really high, it was putting the community at risk in a different way. So we stood up the emergency congregate shelter here at Health and Human Services. And then we received, through the Emergency Solutions Grant COVID funding, we were able to house individuals or shelter individuals who in non-congregate shelter, who either were, there were two different ways that we could draw down funding for that. One was the FEMA reimbursement that Nan was talking about, which is when there were individuals who were sick, who maybe were in their homes, but then like if they had roommates or something and they couldn't stay in their home because of the risk of exposure to the other individuals in their home, then we had the ability to put them in a hotel room. Or if we had, I'm trying to like the tourism, we had individuals who are maybe in a hotel room together, and or there are 2 or 3 or 4 people in a hotel room. I'm trying to think of some of the scenarios of how we put people into non-congregate shelter for that pot of money. And then we also received additional funding because of the inability to do congregate shelter. We were able to draw down funding through some of the COVID relief funds to put individuals who are homeless in non-congregate shelter, which we later found, as this was kind of a nice byproduct of this program, which was that we learned that individuals stabilize. It's kind of following the housing first theoretical theory, I guess, because individuals have their own space. They were able to put all of their stuff in the space, you know, their own room. They were able to stay there, stabilize. They had shelter, their own shower, their own, you know, all of they kind of had their own space. And a lot of individuals who we had heard weren't interested in considering housing, then we're really starting to consider housing in a different way, because we were able to put them in a hotel room and stabilize. So that was a huge opportunity. And after also talking to some other mountain town coalitions, I learned that there are regions who are using this non-congregate shelter approach as part of their strategic plan now. Instead of having a congregate shelter, they're using funding now for non-congregate because they're seeing people stabilize so much quicker and be more inspired to consider different housing opportunities. As Nan said, on a given day, we're between 60 and 70 individuals who are experiencing homelessness or are unsheltered here. And of those 20, we've gotten into rapid rehousing, which if you do the math, that's pretty substantial, especially coming from a community who was saying that that people didn't want to be in housing, right? So it kind of started to shift the whole dynamic. And then of course, the other opportunity was the safe outdoor space. And so that really did capture a lot of the individuals who weren't ready to be in a non-congregate shelter, and didn't have anywhere else to go. There was no shelter for them. So we stood up the safe outdoor space, which had individual canvas tents for each of, and we use some of that COVID funding to be able to pay for this. And then we also identified a peer mentor or a peer specialist that was kind of like helping to manage the outdoor space. And there was additionally a large tent as well that had heating and cooking, and that's all in addition to what Nan was talking about, which was the sanitation stations and having the bathrooms and things like that available for individuals as well. So the grants that we used to pay for some of that stuff were the emergency solutions grants. those were the shortened version of that is an ESG COVID specific grant. There are emergency solutions grants. They have been around for many, many years. These were really specific. It was a surge of money that came through for specific to COVID. And we are continuing, as Nan said, we have another provider now who received the most recent supplemental grant with emergency solutions. So that has brought great success in infrastructure to our area. The CARES Act funding as well. And that was through some of that kind of FEMA reimbursement. We were able to draw down some of that. And then we don't have any ARPA funding yet, but we believe that at least Pitkin County is in position right now with some of the infrastructure build out, as well as strategic visioning and planning that we've done, to be in a position to receive some of that. We are working on the roadmap process with the Aspen to Glenwood region to set priorities and think through how we're going to basically how we're going to prioritize the funding at when and if it comes through. I mean, it's already been approved, so it will be coming through. So those are all the opportunities. In terms of initiatives, so we talked a little bit about Housing First already, but that really was, I think that the Housing First that is complemented so well by the centralized data and HMIS and QBNR. So that's a lot of, look at all those little HMIS, QBNL, that's a lot of acronyms there. So HMIS stands for the Homeless Management Information System. It's actually a national system. So every single state, I believe, in the United States has it. And really the states independently are working towards gathering data, accurate data on what's happening in terms of homelessness for every part of the state. So centralizing our data, getting a lead to enter that data, and then developing a QBNL, which stands for a quality by name list. And all that really stands for is a list of all the individuals who are experiencing homeless that come into our system of care, and then identifying their vulnerability and need, and what the best fit is for housing for them. And that's really given us the opportunity. So that has shown people that Housing First works. So we did the webinars, which were huge, and that was so important. We also brought in a subject matter expert into our kind of case conferencing, or when we would meet to talk about all of these clients and where they're at and what their plans are and things like that. She also came into those meetings and helped bring that kind of theoretical approach or that lens when we're talking about different clients. And what I will say is that the shift that happened from this kind of punitive and, reward type, like thinking about housing as a reward for hard work and, and good behavior and all of that really shifted. It really changed. And then we had the data to show it as well. So I just felt like those two things really went hand in hand. The initiatives that some of that funding brought to us were programs called Street Outreach. And what Street Outreach is really when someone is unsheltered and they are not living in an emergency shelter, or they're not living in non-congregate shelter, they're literally living what it sounds like. They're on the streets. And it's case managers who are going out, individuals who are going out and meeting them where they're at, gathering information and helping them come up with a plan. And then also addressing any barriers that are coming in the way from them getting in any sort of housing. Emergency shelters, another program that we receive funding for. That's how we're paying for a lot of the non-congregate shelter. And now that we're looking into this winter, considering how that funding can be used to work through our strategic plan around emergency shelter. And then rapid rehousing, which Betsy explained as well. It's another program, and it's really meant for people to have very short periods of homelessness. So if someone is evicted tomorrow, we would hope that the way the system should work is that they get kind of wrapped up really quickly into this system of care and are offered rapid rehousing, are able to, and we're developing or building an inventory of rapid rehousing units so that we can kind of quickly put somebody back into some sort of shelter space while they're working on getting back into permanent housing. And then, of course, the initiatives that we were so hopeful to see that Recovery Resources is a local nonprofit organization. And we had emergency RFP'd some of the business that we got through local government. And they really had a pretty compelling request as well. So we were happy to see that, and they've really brought a lot to the table. So that's a new thing that's happening in our community that we didn't really expect, but are so excited about. And then that really like enhanced and coordinated case management. We are meeting weekly now with different stakeholders. So we have like Mind Springs Health, the mental health center. We have, sometimes we'll have somebody from the 9th Judicial or from like jail staff, or not jail staff, but like probation. We have Recovery Resources, Aspen Homeless Shelter, Pitkin County. So it's case managers from all of those entities who come together once a week to look at that quality by name list, talk about what's happening, and make sure that nobody's falling through the cracks. So we went from, if you look at our point in time counts for our region over the past, 10 years, you'll see that point in time counts historically, we've had, between 8 and 10 people. Oh, and by the way, a point in time count is when on one day of the year, you count how many individuals are either homeless on the streets and in shelter, or there are some years where every other year they only count the individuals who are in shelter. So this year they did a full point in time count, and we went from historically having between 8 and 10 people on that count to having, I think, was it like 64 or something, 64 individuals in 1 year. And that was because we had the infrastructure in place. We had that kind of community buy-in, quality by name list. We had the case managers coming together. So we had a really nice system to help pull that data together. I'm going to hand it over to Cristina, who's working on some different initiatives as well.
Thanks, Lindsay. It's great. It's exciting to, even as a group, we know all this, but to see it in one place is really amazing and great work. And I'm going to talk about some other work that's been going on in our region that couple things I wanted to mention. Betsy has amazing permanent supportive housing experience, so she can talk about this more with you guys as well, and I'm sure she does. I thought, Nan, your comment about the strategic plan was really on target, because one of the reasons that we're able to even look at permanent supportive housing, which is essentially affordable housing with on-site services to provide individuals experiencing homelessness with many needs with those services. But that housing first concept definitely applies, because we're talking about people that may not have been housed for a long time. And the first step is for them to be housed and to start to feel safe. I've visited different permanent supportive housing projects in Denver and Greeley, and one of the spaces they actually have an outdoor space where people can sleep outdoors if they don't feel comfortable in their room right away, and it's like a secure courtyard, because it takes time. And so you're working with individuals who need that additional support to become housed. And at that point, as they start to feel safe and take some, get to be part of a community, which we saw with the safe outdoor space as well, then they're ready to seek services, and they're ready to become part of the community because they have a home and they're able to address other things that they might be experiencing. And so it's really exciting. This would be the first permanent supportive housing project in our region, which is just awesome. Usually they're easier to have happen in larger places. Part of our challenge has been finding any sort of possibility of where to put it because of our extreme cost of housing in the rural resort regions. West Mountain Regional Health Alliance looked at focusing on permanent supportive housing specifically because housing and health came up as one of the top issues from the public health needs assessment. And this was done in the Tri-County region, including Pitkin County Public Health. And at first we looked at housing across the board. Are we looking at housing of healthcare workers? Because we know that's a need, or other things. But we felt when you look at housing and health, one of the biggest places where it makes such a huge difference is for individuals experiencing homelessness. It also impacts the healthcare and the first responder system in a significant way. And so having people housed can drive down some of the costs associated with these individuals living on the street or in a campground that maybe isn't sanctioned or, or looked at. And so that's really why West Mountain chose this particular area. And then we had to figure out how the heck to do this. My expertise is definitely not in housing. We've all learned a lot over these last few years. So was able to secure a grant from the Colorado Health Foundation, and this pilot grant gave us the chance to work with people who do permanent supportive housing. So they knew how to make that happen. And then we just received another grant for this year as well. And so we have potential properties identified. We actually, since this slide, we have a couple places where we can look at permanent supportive housing. And the best part is there's funding out there now. So because we've done all this back work, we've created the partnerships, we're now really poised in a very significant way to move forward with this if we can get the property secured. And that's what's so exciting, because again, having that plan in place and having already worked on it, we have this ability. It would be, and basically DOLA is like, we have money, Division of Housing is saying, and because you guys are far enough along, we want to help you make this happen. And that's super exciting. The other thing is just having those experts involved has been crucial for our, because even to know where to start. And so that's been really helpful. And from this process, we've developed partnerships to talk about who would want to be, part of the service provision. And then developing the right relationships, the state contacts, all the things that have been discussed, we've received. So that's helped us get the funding and the resources to move this forward. And what's awesome with Pitkin County as part of the housing stability, getting to that data where there is a solid understanding of the needs and those who would be best served in permanent supportive housing is huge, because that again strengthens our case to receive those funds, because they're like, wow, you do really have that need for permanent supportive housing in your region. Exactly. And so then the other thing we, Built for Zero, this is really a national movement to end homelessness, but it has a specific importance here in Colorado, because the state of Colorado and the Division of Housing and the Division of Homelessness Services, this is something that Colorado is the first state to take this on statewide, and they started with 6 communities. I think it's grown now to 8 or 9 who are trying to use this to employ this along with coordinated entry, and working together. That's what's going to get to the point to try to get to functional zero homelessness. And when I say functional zero homelessness, essentially it's just the idea is that you get to a point where you're at almost zero, but of course there's going to be an influx of in and out sometimes because people will experience intermittent homelessness. But the point being, if they do, we can deal with it really quickly and get them back to housing. And so that's really, really exciting. Regional, I think Pitkin's been a leader in this, which is awesome. And being part of the leadership steering committee team has been awesome, because we're seeing how it can happen in some of our other counties, and there are good things happening, but creating that system of care is really where we're trying to go. And we know that within our region, we have people that move up and down the region sometimes. And so making sure that we can serve individuals in different parts of the region is very, very important to us. One of the things, we just did a recent survey around some of the homeless service provision, and the top need that was identified almost was funding. And the cool thing is we've received some funding, and Pitkin County received ESG CV1 as was discussed. And now Garfield and Eagle have received some as well. And we're trying to look at that from a regional perspective, because we know that in the future funding will need to be regional. And so it's all about creating that big continuum of services. So happy to answer any questions, and thanks.
I'm going to just talk, I think we've touched on almost all the lessons learned, but I think it's always good to sort of wrap up with what were the things that made this work, that's made our collaboration successful. And I think building a system of care, there's no one solution for all housing folks. Shelter isn't the only solution. Permanent housing isn't the only solution, but being able to really to work with people where they are and where they want to be instead of where we think they should be and building a system around that has been key. I think data, Lindsay touched on it, data is extremely powerful, especially for policymakers, to confront some of the negative narratives about people why people become homeless. Housing first, we talked a lot about, we're all big believers in that, and I don't think it would work without that philosophy. We also included people who are homeless all along the way, and that keeps us legit. I don't think you're really real unless you're hearing from the people who are living this experience. Obviously, celebrate success along the way. We're excited to even be able to present it to everyone. And then we all like each other, which really helps a lot. I don't know how to force that, but also be patient and realize, I think a lot of times people want to see a solution right away. That's not, you can get something right away, but you can't get a really comprehensive, well thought out solution. Externally, I think one of the things I want to say is the leadership of Pitkin County in this has been this would not have worked without it. You need a backbone organization that gets it and that's willing to push and push back. Probably the single most important thing was that we undertook a strategic plan and that gave us direction and we were able to tap into it whenever opportunities arose. You can't start a strategic plan when the funding comes out, but you can actually be in a much better position to get the funding if you have the plan. The next two things seem almost counter to one another, but they're not. It's maybe it should say think big first. We set a big vision, and be on the path to, end chronic homelessness, be on the path to ending all homelessness, but then set achievable goals so that you can look back and bite off a chunk that you could really do. We have a small enough population, even though 60 or 70 seems like a lot. You say, well, but we have 8 veterans. Let's focus on that. We have 6 families, whatever. We can do 20 in permanent supportive. Identify a courageous housing search and placement team. It's hard. This work is hard. And as a houser, I have the easy part. I built, I put the sticks and the bricks together. But getting the people to actually working with outreach and case management, so people need to, or even, with the folks who are peer specialists, you really need people who are courageous and who stick with it. And then funding, the state is there. There's new funding. You saw how we got funded all along the way. There are new programs out there all the time, and to deal with homelessness. There's something right now about buying motels or underutilized motels for this purpose, but you can also twist isn't the right word, adapt existing programs to fit dealing with homelessness. And that's how I did supportive housing. I didn't need a special program for it. I went after all the existing ones and made them work together for the purpose. So, make sure that you are optimistic about the ability to actually achieve your goals. And I think that's our last slide. And we have like 4 whole minutes. Oh no, we still have more. We have next steps. I don't know if we have time for this. I really wanted to give a little time for people to ask questions. I think those were things we touched on, but we'll have the slide available. Does anyone have a question, a burning question? You can either do it through chat or through Q&A, or I could even unmute you if you raised your hand. I know we still have quite a few on. No questions? No, it doesn't look like it's great. Well, this is our contact info. We're looking forward. I'm super excited about Cristina getting, permanent supportive housing is really this solution for chronically homeless people, and where people can kind of stay, and we call it permanent because they can stay there. There's no term limit on their lease, and in housing, in areas where housing is such a difficult thing to getting 20 units, new units of housing is exciting. So I think if there's anybody else on the panel want to add anything at this point? No.
I would add that, we found subject matter experts like Betsy and Phil Harrington, who's the deacon of the Catholic Church, who's the executive director of Fort Lyons. So we found people in our community that we didn't even know existed who had extraordinary experience building a system of care. And I think that in the rural mountain communities where we all live, we have second homeowners, we have new influx of new people. I think once you cast the net, and we got a lot of good press coverage, we always invited the press to our coalition meetings, more people surfaced. So, it's really the power of the people, so to speak.
All right, I'm going to thank all of you who attended for attending. Feel free to reach out to any of us or to Becky at Colorado Mountain Housing Coalition. I personally will end this by saying it's been my experience that ending homelessness is achievable. And I don't let anybody tell me that it's not. And I think Cristina's idea of functional zero, someone who enters homelessness should be able to find their way out in a short amount of time if we as a community put our heads together and our skills together and go for it. So so thank you for attending, and this will also be sent out. I think it'll be posted on the Mountain Housing Coalition website and sent out. So thank you everyone, and we'll be in touch. And thanks to the panelists. Bye.
Bye. Thank you, Betsy.